All right, let's jump right in. Today, we're going to break down something absolutely fundamental: how our lungs work, and more importantly, the two main ways they fail. We're taking a deep dive into the core concepts from a pretty detailed medical presentation and boiling it all down for you. So, have you ever really thought about this? It's kind of a weird question, right? I mean, trouble breathing is trouble breathing. But it turns out the direction of the struggle, whether you can't get air out or can't get air in, is the key to understanding almost everything about lung disease. And here's the good news. The answer is actually pretty simple. You don't need to memorize 100 different complicated diseases. At the end of the day, it really just boils down to two basic patterns of failure. Once you get these two, the rest starts to make a whole lot more sense. Okay, but before we dive into what goes wrong, we've got to appreciate what our lungs are like when everything is going right. Because honestly, they are an incredible, nearly perfect piece of biological engineering. Everything, I mean everything, comes down to this little guy right here. This is an alveolus. It's one of millions of tiny air sacs in your lungs. And just look at that wall. It's paper thin. That's where the magic happens, where oxygen zips into your blood and CO2 gets kicked out. It's an absolutely miraculous and incredibly fragile design. So, keeping that perfect little machine in mind, let's look at the two fundamental ways it can break. This is the big idea for today, the core concept: obstructive versus restrictive disease. And these analogies, they are perfect. For an obstructive disease, think about trying to breathe out through a clogged up, narrow straw. You can kind of suck air in, but getting it all back out is a real struggle. Air gets trapped. Now, restrictive disease is the opposite problem. It's not about getting air out, it's that you can't get enough air in. It's like trying to blow up a balloon that's stuck inside a hard plastic box. The balloon just can't expand. All right, let's dive into that first category. We're going to start with the clogged straw problem, the diseases of obstruction. And the classic example here is emphysema. The key thing to understand with emphysema is that the walls of those little air sacs, the alveoli, are physically destroyed. This damage makes them lose their natural springiness, what doctors call elastic recoil. That spring is what normally helps push air out, so without it, old, stale air gets trapped, making it incredibly hard to exhale. And wow, this picture really tells the story, doesn't it? On the left, you've got that beautiful, strong, honeycomb structure of healthy alveoli. But on the right, look at that. In emphysema, those delicate walls are just gone. You're left with these big, floppy, useless air sacs. There's no structure, nothing left to help push that air back out. Okay, so asthma is also an obstructive disease, but it's a totally different beast. With asthma, the problem isn't destroyed lung tissue. Instead, it's about inflammation. The airways themselves get narrow, they swell up, and they get clogged with mucus. But here's the really crucial part. Unlike the permanent damage you see in emphysema, this obstruction is often temporary. It comes and goes in attacks, and it can be reversed with the right treatment. So let's just walk through this chain reaction of an asthma attack. Something triggers it, right? Maybe an allergen, like pollen. That kicks off this huge immune response. And that leads to two big problems: bronchospasm, where the muscles around the airways just clamp down tight, and a whole lot of inflammation and mucus. Put those together, and boom, you've got that clogged straw, and it becomes a massive struggle to breathe out. All right, let's totally switch gears now and talk about our second category, diseases of restriction. And remember, this is our rigid box problem. The issue here isn't getting air out, it's getting enough air in the first place. And a really, really devastating example of this is ARDS, which stands for Acute Respiratory Distress Syndrome. Now, this isn't a single disease you can catch. Think of it more as a catastrophic, rapid onset failure of the lungs. And it can be kicked off by all sorts of things, like a severe infection or major trauma. The bottom line is, the lungs become so injured and stiff that they just can't expand. And just so we're all crystal clear on how serious this is, look at that number. 38.5%. That's the hospital mortality rate. Almost 4 out of every 10 patients with ARDS don't survive. This is an absolute medical emergency where the lungs physically cannot do their most basic job. So how does this happen? Well, it's like a horrible domino effect. Some initial injury to the body triggers this massive, out-of-control inflammatory response. Your body's own immune system goes into overdrive, releasing all these chemicals that actually end up damaging those super delicate alveolar walls. And when those walls get leaky, fluid from the blood vessels just pours right into the air sacs. The lung gets heavy, it gets wet, and it gets stiff. And this is what that mess looks like up close, under a microscope. You see those bright pink, kind of waxy layers? Those are called hyaline membranes. They're basically gunk made of leaked proteins and dead cells. And they literally plaster the inside of the air sacs, making it completely impossible for oxygen to get across. This is what physically turns the lung into that rigid box.
Okay, so finally, let's quickly touch on a couple of other really critical lung emergencies. Now, these don't fit perfectly into the obstructive or restrictive boxes, but they're all about major mechanical failures. We're talking collapse and blockages.
First up is something called Atelectasis, and really all that fancy word means is collapse. A part of the lung just deflates. It's not really a disease itself, but it's a sign that something is seriously wrong and the air spaces aren't filling up like they should be.
And this illustration is perfect for understanding the three main ways this can go down. So on the left, you have contraction. Think of it like scar tissue inside the lung that's literally pulling the lung inward on itself. Then in the middle, you have resorption. This happens when an airway gets blocked by something, like a mucus plug. The air that's trapped behind it gets absorbed into the bloodstream, and that whole section of the lung just collapses like a sad balloon. And finally, on the right is compression. This is when something outside the lung, like fluid or air in the chest cavity, is physically squishing it shut.
Okay, next up is a different kind of blockage, and this one is a terrifying medical emergency, a pulmonary embolism. What happens here is a blood clot, usually one that formed deep in the leg, breaks loose, travels all the way through the bloodstream, through the heart, and then gets wedged in one of the arteries inside the lungs. And this right here, this is the absolute nightmare scenario. It's called a saddle embolus. It's a huge clot that gets stuck right at the fork in the road, where the main pulmonary artery splits to go to the left and right lungs. It can block blood flow almost entirely. Honestly, this is a cause of sudden death. So, you're probably asking what puts someone at risk for this? Well, it's really any situation that encourages blood to clot when it shouldn't. Things like being on bed rest for a long time, maybe after a big surgery, major trauma. Even things like heart failure or certain cancers can make the blood thicker and more likely to form those dangerous clots in the legs, just waiting for a chance to break free. And that brings us full circle. We've looked at the clogged straw of obstructive diseases and the rigid box of restrictive ones. We've seen how these incredible organs can be damaged, inflamed, collapsed, or blocked. So the final question is for you. Now that you know this fundamental difference, this split between the struggle to get air out versus the struggle to get air in, how does that change the way you think about lung health and the incredible, fragile importance of every single breath you take?